Hi, good evening, good day, good morning, good afternoon. I don't know where you are right now listening to us, but it's a pleasure to continue with this journey of knowledge, with this journey of AI, this intense journey of AI. And tonight we have a great attraction. Then this is a special day because you have here with us Deb Karan Singh Maletia. I hope that I pronunciate part of it rightly and uh, he's from BlueDot. Just a second, I'm going to tell you more about BlueDot. BlueDot is that company, the company that identified COVID before any other institution worldwide. And it's not only that they do identify pandemic. They do much more other interesting things, and I think that Debbie will inform you more details about it. But before that, before we start, I would like to share here my presentation, my screen here, just to say that we are continuing, and tomorrow we will have a great day as well. Tomorrow is our last day, unfortunately. We have a 5 intense days. Tomorrow is our last day, but we have many attractions as well. Don't forget, if you are entering right now, it's the first time that you enter in this day in our event, do your check-in, your daily check-in. Here is our QR code. You can enter there or place your bit.ly dash I2AIXP. You can put this code there and do your check-in because first you get to receive your certificate with the hours, the many hours that you participate in the event, and also every single day you have a raffle for you to win a great prize. Tonight, the prize is from the kit from Susano. I will show you later on. But first of all, don't forget uh, that is a great opportunity for you that is starting with us tonight to associate with us. We, I2AI, is a non-profit association. We are proud to be an international association of artificial intelligence and to promote all these events, all these sports, all these enhancement of artificial intelligence. We need to count with your support. We need to count with the support of our association. Then if you want to help us, if you want to support us, if you want to be part of this great community of to enhance the growth of artificial intelligence worldwide, especially in Brazil as well, please be an associate. There is many reasons to do so. One of the most important ones is that you are going to be in close contact with these remarkable professionals. We call them our notables or remarkable associated. They are all experts on the field in different ways, in different perspectives. There are some that are professions from law, from digital rights. There are others that are professions for entrepreneurship, others that are applications in health, in retail. They are experts in computer vision, in natural processing, natural language processing, and machine learning, and so on. Then it's great to have this great team with us, and only associated can be part of uh, closer events with them, and they are a great part of our association. And then I invite you to take part of it, to try it, to speed up yourself in terms of being connected with all this change that we are facing right now, the digital revolution, and then be part of it, that you're going to receive many benefits to be part of it. Another benefit that I would like to say is that only this week, for all that are in our audience, you can have this 400 reais of discount only this week for our 3 certificates. Yeah? You can get 400 reais for, or to use, you can use it in all of them. You can use in all of them. The AI for Business, you can use for Analytics Foundation. You can use for AI Technologies Foundation. The first one is a great opportunity for you that want to give your first steps in AI. The second one is a great opportunity for you to understand more data science, the fundamentals of data science. And the third one is a tech deeper on the four biggest technologies related to artificial intelligence: machine learning, robotic process automation, RPA, computer vision, and natural language processing. Then there is a great chance for you to take part of it. I also want to thank our sponsors, A2O.ai, Suzano, Semantics. All of them are key for us to support us to make this event possible. Also, EducaCross, ProInfo, FIA, they all ensure that you are all together here, receiving Dev, Karan, and many other celebrities and other experts in the field for discussing this so exciting topic. We have already before Anne Schumacher, but right now, let me put here ideas that I would like to show. Tonight, just before we start with Dev, I want just to say that the person that won this kit here, Suzano, look at that, is Geraldo Pereira Neto. He's the fourth lucky person that got this prize. The first day was Arnaldo de Paula Couto, kit Semantics. Jaime Maciel Sampaio received the kit Suzano, Jonathan Vinicius Kaiser, kit Semantics, and now Geraldo Pereira Neto, kit Suzano. Tomorrow, we have the last two kits. If you want to participate, to take part of it, just make your check-in right now. But make your check-in right now. And without more delays, without further delays, let me call him. David Karan, Singh, Maletia. He's going to tell a little bit more. He's the public sector growth and strategy lead from BlueDot. He's going to tell us more about using AI for augmented infectious disease intelligence. Yeah. If you are concerned with your health, David, tell us about what BlueDot is doing right now in these terms of helping us to keep health.
Absolutely. And thanks, Alex, for that wonderful introduction. I'll just take a quick second and start sharing my screen here. Is my screen visible, Alex?
Yes.
All right, perfect. So first of all, extremely grateful. Thank you for inviting BlueDot to participate in this wonderful conference. And Alex was kind enough to introduce me, but a little bit about myself. So I lead the public sector growth and strategy here at BlueDot, working across the globe with public health organizations, ministries of health, governments, and even enterprise clients, helping them and collaborating with them on revolutionizing how the world is currently managing outbreaks. And the very crux of our platform, of course, is artificial intelligence. But before I get into the nitty-gritties or the technical side of things, I just want the listeners to start thinking about some of the questions which I'm presenting. And okay, question one. What have we done differently in the past 10 years, right? As we have experienced over 5 epidemics/pandemics and public health emergencies over the past 10 years. And yes, COVID is not the only pandemic or international public health emergency. There have been over 5 in the past 10 years. So have we done anything differently or not? So I would encourage everyone to start thinking about this particular question. Second question, what are the best options that are available today in terms of technology, in terms of resources, to rapidly detect, assess, and respond to any infectious disease threats? And this question is posed to everyone who's listening, especially if there are any government organizations or enterprise organizations like CPG or pharmaceutical companies or vaccine manufacturers. What options are actually available for us today, right? To rapidly tackle and manage and control infectious disease threats. Third question, when should we act if we are aware of these options? And I think everyone already knows the answer, but when would be the right time to start acting if we are aware of the best options available to detect, assess, and respond to infectious disease threats? So with these three questions in mind, and I would encourage everyone keep thinking about these questions while I'm going over my presentation over the next 30-35 minutes. But I'll start addressing each of these questions one by one. First, let's, again, before getting into the technical details of artificial intelligence and how it is revolutionizing ID threats management, let's understand how our past 10, 15 years have actually looked like. So this unfortunate image on the screen is from 2019, December. We all know what happened back then. The first case of COVID was detected and it started rapidly to spread. Undoubtedly, one of the biggest infectious disease outbreaks or pandemics which our world has experienced over the past couple of decades. At least everyone who's listening right now, in our lifetimes, this has been undoubtedly the biggest pandemic which we have experienced, and hopefully we don't have to experience in this lifetime again. Well, COVID-19 came in 2019, of course, but this let's go 3 years back. There was another global public health emergency, and we see this beautiful child in the picture. There was a virus, a pathogen, which was being spread by mosquitoes and hugely affected South America. This was the Zika virus, right? And another big public health emergency. Going 1 year in the past, in the history, 2015. Well, this image tells a lot, right? How our world has changed. Something which was unusual, wearing masks in an extremely social event that is a marriage ceremony, which was pretty odd to be seen back in 2015. And now it is a part of our day-to-day lives, right? We cannot move out of our homes without wearing masks anymore. So this was a result of MERS, that is Middle East Respiratory Syndrome, which literally crippled South Korea back in 2015. 1 year in the past again, 2014. And my sincere apologies, it's a pretty sad image, but this is an image from West Africa, where the worst ever recorded Ebola outbreak in human history claimed over 10,000 lives and spread across the globe as well. In fact, just 3 or 4 months back, our system again captured Ebola cases re-emerging after 4 or 5 years in West Africa. Going 5 years back in the history, 2009, again, an image which was unusual back then, but pretty common right now. This was the H1N1 influenza pandemic, again, which crippled most of the parts of the world. This is how our past 10 years have looked like. Moving one step back in the past, this is an image from 2003. The same effect which COVID-19 has had on our entire globe in every single city on the planet. There was another epidemic back in 2003, which was the first novel coronavirus outbreak ever recorded, which was the SARS outbreak, right? And literally crippled the city of Toronto. Why I was showing these images was to help everyone understand how the past 20 years have looked like. Population growth, climate change, multiple factors have contributed towards it. Vaccine hesitancy, we have been hearing this a lot lately. People are connected by global air travel more than ever. So my family's in New Delhi, I'm here in Toronto, and it literally just takes me 13 hours from my home to reach my home, from my home in Toronto to reach my home in New Delhi. So global air travel, we are extremely, extremely widely and fast connected with the entire planet now. Bioterrorism, right? All these factors have contributed to infectious disease threats, public health emergencies, epidemics, pandemics occurring across the globe 1 year or maybe maximum with 2 or 3 years gap in between, right? And needless to say, I'm not counting here the endemics, which are locally spread within the country. If we start including them, then I'll have no space on this particular slide itself. So just want everyone to start thinking about why there is a need to make sure that we are rapidly able to detect, assess, and respond, and use artificial intelligence and other modern technologies to tackle global pandemics and their spread. And that resulted in this man on the screen, Dr. Karan Khan, who is the founder and CEO of BlueDot. Was recently, he had finished his training in infectious diseases, preventive medicine, and was one of the frontline workers back in 2003 when the SARS epidemic literally crippled the city. And that event was so moving for him. He was so deeply motivated by that event that he decided to dedicate his professional and academic career to build the academic foundation of a platform which is able to help governments, enterprise organizations, people globally to prevent any such infectious disease to happen again, or at least mitigate its spread to the maximum extent possible. And that led him to design and lay down the academic foundation for a global epidemic intelligence platform, which I'll be talking about right now. So typically, and you must have observed, I'm calling out these three things multiple times: detect, assess, and respond. These are undoubtedly the three most important pillars, and people who are the scientific community who might be listening to me, they might already be familiar. This is also pretty much in line with the International Health Regulations 2005, which were released by World Health Organization, according to which all the countries or all the WHO member states are supposed to abide and be prepared around these three pillars as well. And that's how Dr. Karan Khan also started building the platform around. Talking about those three pillars, first one being detect. Let's go by the literal meaning. What is detect? Being able to identify where infectious disease events are happening across the globe. Alex did mention that our organization was one of the first in the world to detect COVID. So that falls under the detect pillar, and I'll be explaining how we were able to achieve that. So having the ability in terms of technology, in terms of resources, to make sure that the right events of infectious diseases are being captured, they are captured in real time so that the decision makers, be it whatever organization they are supporting, be it a government agency or a private organization, they are able to rapidly and quickly take decisions to control and contain that infectious disease event. So that's pillar number one. Pillar number two is assess. So what does this infectious disease event mean for me? What is the associated risk? What is the likelihood that this infectious disease, I'm just taking an example, an unknown illness has been observed over the past 2 months in India. So what is the likelihood that that infectious disease can travel to Brazil, for example, or Canada, for example? And what kind of impact can it create in the geographies of our interest? Having the ability, the technology to understand how the disease or infectious disease event will disperse is absolutely required so that we are able to contain it, to control it, and mitigate its spread as much as possible. So that is pillar number 2, that is assess. And pillar number 3 is respond. What does this entire mathematical data, this entire scientific data mean for me? By me, I mean a decision maker, right? So how does all this information can be gathered together into actionable insights for the right people to start taking the right decisions, again, to mitigate the spread and control the infectious disease to the maximum extent possible. Right? So all these 3 pillars are very important, and my apologies to the scientific community who might be listening for oversimplifying. It's not that simple. It's an extremely complicated process, but these 3 pillars are definitely important to be a part of epidemic intelligence platform. But what is more important, and what we have learned, and every common man has also learned over the past 2 years, is that a pathogen, a virus, an infectious disease travels and spreads extremely fast. And if we have to control it, we have to be faster. It's a pretty simple mathematical equation, right? You have to, if you're in a race against a particular infectious disease, we have to run faster to beat that infectious disease and prevent it from crossing that finish line and creating that mass destruction. So transition from detect to assess to respond is extremely important when it comes to any modern epidemic intelligence platform. So moving one step ahead, now you might have seen similar curves in a lot of media articles or a lot of reports lately, but this is important for our presentation today. What is a typical epidemic life cycle? It's pretty simple, a graph which we used to make in high school or during our school days. On the x-axis is the time elapsed from the first confirmed case, and on the y-axis is the maximum daily number of cases. And it's pretty simple to understand. Initially, the curve increases and reaches a particular threshold when there are maximum number of cases being recorded. And eventually, because of multiple reasons, because of natural immunity, which people might develop after getting infected or through vaccinations or medications, changes in the ecology of a pathogen or mutations, eventually the number of cases start to decrease and a pandemic comes to an end. Good news is even COVID will eventually come to an end. The question is when, and can we accelerate it or not? And can we prevent similar infectious diseases to spread to the level to what COVID had spread earlier, right? 2 years back, and still is spreading. So, and it's pretty simple. If we are able to detect early, if we are able to assess quickly, we'll be able to respond quickly and prevent this curve to be as short in height and as small in terms of length as possible. So moving on, I'll be taking each of these pillars one by one, and now I'll be explaining how artificial intelligence and machine learning and other computational algorithms can play a role in making sure that detect, assess, and respond is rapid, is actionable, and is quick. So let's talk about early detection of diseases and how artificial intelligence can play a role there. So this is one of the core or the base methodologies which BlueDot follows, right? And one of the biggest strengths of our platform. We use artificial intelligence, machine learning to augment, to enhance global infectious disease surveillance. Imagine there is a big funnel, which is BlueDot's surveillance engine. what goes in that funnel is official reports, unofficial reports, basically any kind of unstructured textual data. And what is unstructured textual data? It's could be articles, could be uh, RSS feeds, could be media sources, social media, so on and so forth. Right? So when it comes to official reports, our platform tracks any kind of official public health reports. For example, if Ministry of Health Brazil is releasing certain official reports, or US CDC, or Public Health Agency of Canada, so on and so forth, or WHO, of course. Any kind of moderated sources, for example, ProMed. And one of the biggest part of our surveillance engine is having the ability to track these unofficial reports in over 72 different languages globally, right? Which is ingested into our surveillance funnel every 15 minutes. And all this data comes from over 30,000 different sources of information, comprising roughly 350,000 articles of information, right? Which is practically impossible to be managed or analyzed by humans directly. They all go into the funnel, and that's where the natural language processing and machine learning algorithms start to play a role. They automatically deduplicate the data, filter out irrelevant articles, and extract right information about any infectious disease which is occurring globally, what pathogen is causing it, what is the location where it is occurring or spreading, and any kind of contextual data around the same. So the entire unstructured textual data is converted into structured data. So those 350,000 articles of information, because of the power of artificial intelligence and machine learning, they get filtered down to just 500 or 600 most relevant and accurate articles of information, which is then analyzed by our in-house team of subject matter experts, which is a team of epidemiologists, data scientists, veterinarians, so on and so forth. Right? So moving one step ahead, what Alex was mentioning earlier, we were one of the first organizations to detect an unusual disease, an unknown respiratory syndrome, which had pneumonia-like features or symptoms, which was growing in the Hubei province in China, right? And it was picked up from an unstructured data source, which was a business journal article that had reported this growing number of cases, which immediately got in real time detected by our platform. And our subject matter experts quickly verified that information, considering the pathogen characteristics, the overall ecology, how quickly it is spreading, why it is spreading. And on the morning of 31st December 2019, immediate notification was released to all our users. And this was around almost a week before any kind of official public health announcement was released. Over a week before COVID actually got its name. Until then, it was just being called an undiagnosed respiratory syndrome. So this is one step where artificial intelligence can definitely start acting value to modern epidemic intelligence platforms. Moving to the next pillar now. Remember, the first pillar was detect. Now the second pillar is assess. How do we ensure that we mitigate the spread of this infectious disease? Because only if we are aware how the disease is spreading, where can it spread to, and what kind of risk, what kind of potential damage can this infectious disease cause once it lands in a different geography, that is all about mitigating the importation or the spread or dispersion of that particular infectious disease. And how our technology is able to do that, I'll explain now. So as we know, this is no news to everyone, billions and billions of people on our planet who are currently acting as vectors of infectious diseases. When people move, communicable diseases spread. At the same time, billions of people on the globe, they now have access to smart devices like you and I. All audience who are listening to this presentation, they have smart devices to which they are listening to. I have a smart device using which I'm presenting it. And all of us have access to internet as well, especially mobile phones. Right? So, and I would like to underline this, we are using anonymous mobile devices data globally as well to predict how the disease will spread from one location to other. And again, I would like to underline it that we adhere to all privacy laws and regulations when we are dealing with this 100% anonymous mobile devices data. And how we started to use it. Now, what you see on the screen, as soon as COVID was detected in Wuhan province by our platform, similar images. So this is an image from our artificial intelligence platform, right? And the small dots represent the number or the concentration of mobile devices among the population. And our subject matter experts immediately started to track and understand where the infectious disease is spreading to, or where this pneumonia-like or COVID-19 is spreading to. And within 14 days, we observed new cases or the same mobile devices were observed, a part of those in Tokyo, in Seoul, Shanghai, Taipei, Hong Kong, and Bangkok. So this means people were traveling from these locations over the next 14 days and using this ground-based travel, including road, railways, on foot. This is one way how mathematical algorithms in the backend of our platform play a role in helping organizations understand how the disease is spreading so that the right steps can be taken to mitigate it. At the same time, a pretty interesting image, what you'll see on your screens. This image was literally generated within 2 seconds once our platform ingested that unusual activity and alerted our users. And what this image is all about, so we also use global flight itineraries to understand how passengers, depending on passenger volumes, between domestic airports, between international airports, we combine all the information that we have understood from detect and assess earlier, combine it with global, international flight and domestic flight itineraries data to understand where this disease can eventually spread to. And using again, the power of AI, ML, other mathematical computational algorithms that are running in the backend, we are able to give a prediction for the next 1 month that what is the likelihood of importation of these cases to any geography on the globe, be it at the city level or at a state or provincial level or at a national level. And one good case study that I can talk of, so Taiwan Center of Disease Control, that is Taiwan CDC under the Ministry of Health, they were using our platform back on 31st December 2019. And immediately when they saw this notification, combined with the risk alert that X number of cases can actually travel to Taiwan in the next 1 month, they immediately use that information to make sure that the relevant border restrictions or airport control measures are in place. And if you're not aware, like Taiwan has had one of the best COVID responses in the world. And we are proud of the fact that we did play a small role in ensuring that that happens. Using the same technology, we were able, by the time the first official announcement was getting released, we were the first organization on the planet to release a peer-reviewed paper on where COVID-19 will most likely spread to. And as you can see, the dots which I showed you earlier, all those cities are in the list. Our system predicted Bangkok to be the first city internationally to receive COVID cases. And as we all know, Bangkok was indeed the first city where COVID cases were reported outside China. Moving one step forward, yes, what we have understood so far is how can we control or mitigate the importation or exportation of any particular infectious disease from its origin to a different geography so that we can control it, we can try and contain it. Next step is, what should we do, or how can we further help using our backend technologies to mitigate its domestic transmission? Already when the cases are high, already when the COVID has reached, or any other infectious disease, Zika or Ebola, it has reached our geography, how can we try and contain it or mitigate its dispersion? So this image, what you see on the screen, another case study I would like to talk about. So we have been working with the Public Health Department for the state of California, or the province of California in US. And what you see on the screen, they were again using, with BlueDot's help, the mobile devices data to understand and track population movements. And we were working with them when the first stay-at-home orders were issued by the local government authorities to understand what kind of pharmaceutical or non-pharmaceutical interventions, NPI measures, are required. Are the populations adhering to the same or not? And what steps further should be taken to protect the population, to protect the economy, to protect the infectious disease to spread further? So that's another way how BlueDot has been contributing. And the list goes on and on, but in the interest of time, I'll just talk a little bit about the type of organizations who have adopted our platform, or the type of organizations who seek to adopt our platform. So as I mentioned earlier, I'm the public sector growth and strategy lead. So I work with public health organizations, national defense, national security organizations globally, disaster response or disaster management orgs as well. And when it comes to private sector or enterprise sector, international airlines, airports, you can see a couple of known names there on the screen. They are using the platform to protect the safety and health of their own employees, to ensure that there is a good business continuity plan, and also around supply chain management. And the use cases are humongous, especially when it comes to the enterprise sector. So that's how our platform using artificial intelligence is able to address each of these three pillars: detect, assess, and respond. And there are multiple ways how we deliver this data, depending on the needs, depending on the use cases, on how we can best support an organization, a client, or a partner to take the right decisions against spread and control of infectious diseases. So we have DaaS applications, that is data as a service. We have ready to use, commercially off the shelf available SaaS application, which is software as a service. And of course, there are consulting services as well, which our in-house team of subject matter experts extends to our clients. And all this information, when it comes to detect, assess, and respond, is made available in real time to all our users. So the power of artificial intelligence is, with as soon as our system ingests a source of information, in less than 11 to 24 hours, the entire contextualized risk assessments, the surveillance information, and the respond information is shared with our users. So it's a pretty busy map, what you see on your screen, and each of the red boxes here symbolizes the number of infectious diseases which are currently having active cases in that geography. And the first time when I saw this image in our platform, I was unable to believe it, that, okay, there are so many infectious diseases currently occurring across the globe, right? And so there is a definite need to rapidly detect, assess, and respond to these infectious diseases. At the same time, just apart from detailed information, we also help our clients understand the impact that these disease outbreaks can have in your locations. For example, what you see on the screen is a small summary of risk assessment for the next 30 days of dengue for Brazil, right? So this is the type of information which is made available to our clients, again, powered by artificial intelligence. And of course, COVID-19, we have a separate part of our platform, which specifically addresses over 80 parameters related to ecology of the pathogen, related to case counts, numbers, vaccinations data. When would it be safe for governments or private sector organizations to start reopening their offices or their borders to the general public? All that information is made available through our COVID data suite as well. And of course, we cannot forget what, again, all these computational algorithms are empowering is any kind of daily or weekly risk briefs, notifications, breaking news alerts. They are all made possible through this rapid epidemic intelligence platform to our users. And with that, I come to an end to my presentation. This is, of course, our team here, what you see on the screen. And this is me, in case you wish to learn more or get more information. Of course, you can contact Alex's team or can directly get in touch with me as well. Thank you. I'm open for any questions, any feedbacks.
What a great speech, Dev, and what amazing job with what you have done, what BlueDot has achieved so far. I knew the achievements, but you show how, and this is interesting, very interesting, deep. You see how complex it is to reach this kind of achievement, to be fast and efficient, identify healthy threats and other issues. And I'm sure that this is a kind of application of AI technology that has many implications for the society. One of them is to support us to keep ourselves in a safe place. And based on that, there is some questions here. I'm going to start to make some of them. One question is related to challenge, because I would imagine that to reach this level of sophistication, now you show that for any kind of step you need to develop data collection, data understanding and analysis. Should have, I get that you should have more multiple algorithms to do part of the jobs, and it's a complex solution. What you would say that were the main challenges to reach the today's level of BlueDot that you need to overcome? Like you said in the past, hey, this was impossible, this would be very difficult, and then you find a way to solve it. Can you make this kind of analysis from the BlueDot journey, from what it was until what it is, and what kind of challenge you need to overcome?
Absolutely. Thanks, Alex. It's a wonderful question and a pretty relevant question as well. So as I mentioned earlier, it is over 2 decades of work has gone into where we are currently today, right? So Dr. Karan Khan started his work back in 2003 and has been almost 18 or 19 years now, right? So initially we started with just surveillance, right? And I'll give an example. slowly what we started to understand was that yes, identification of these infectious disease events is important, and artificial intelligence, uh, machine learning based classifiers, they play a huge role in making sure that that happens. But to understand how this disease or any infectious disease, for example, can travel from one place to other was one challenge which our team took up a couple of years back, right? Combining that information with ground-based spread, with air travel data, and having the right models, that is mathematical models and algorithms in place, was one of the biggest challenge for our organization, which we have achieved today. And I'm proud of the fact that we are currently the only organization on the planet which are able to calculate risk of importation of a particular disease from one geography to, say, our geography. I earlier gave the example of unknown illness, which is currently rapidly growing in India. So a lot of our clients across the globe, they are using this technology to understand what is the likelihood that this unknown illness, which we don't know what is the cause, how is it likely that it will land in our location of interest? And another good case study, uh, which I can talk of here, is National Institute of Infectious Diseases in Japan. They used our platform to ensure, okay, this is a fun fact for everyone. We did play a small role in making sure that Olympics actually happened this year, right? So the Ministry of Health in Japan, they were using our platform to ensure and identify that what kind of infectious disease risks or what kind of COVID variants can different athletes and their overall teams. It's not just one or two athletes that come from a country, right? It's hundreds of people who accompany them, their entire teams. What kind of risk do they pose to Tokyo or Japan per se? And most importantly, once they go back from Japan to their own countries, is there a likelihood that they'll carry any infectious diseases with them, right? And they were using this very technology of understanding the importation and exportation risk to ensure that the Olympics are commenced successfully, right? So this was one big challenge, and this is how our organization evolves. Whenever there is the power of software, the power of artificial intelligence, machine learning is that you can quickly adapt yourself to emerging needs of different clients or related to different infectious diseases and start acting accordingly.
Oh, great, great. You make me think a little bit about it. Oh, yeah, it's a unique event, Olympics. You bring everybody from every country in the planet to the same spot and then send them back. This is really the chance of things, unique things happening. It's very, very high. Yeah? Great point, Dev. Another question here. In your perspective, what would be the natural evolution of BlueDot? BlueDot now is doing what you show us with many success. What do you think that would be things that BlueDot would be doing in 3-4 years from now? I don't know.
Okay, that's a good question. Maybe the right question for Dr. Cameron Khan, but
Yeah.
Going by my role in the organization and the mission which our organization is after to make the world a safer place, the only mission which our team is onto is to join hands with as many clients or partners as possible across the globe to make this technology accessible to them, keep learning from them and they keep learning from us, right? So that we are able to solve as many challenges as possible. So that is what the next 2 or 3 years, I would say, for BlueDot will look like, right? So we have clients across the globe when it comes to Asia Pacific, Middle East, Africa's, North America's. So the goal is to give access to this technology and make it more robust, right? So we keep listening to our clients, to their feedbacks. One example is Now, a lot of countries, almost all major countries, are talking about a unique concept called One Health approach, right? And the scientific community who might be listening to me might already be aware of this. What that means is having infectious diseases, environment, disasters, management, animal health, all into one single bucket called the One Health approach. So that is another area which BlueDot is slowly starting to progress towards. That is, now we are also very soon starting our surveillance and the whole process of detect, assess, and respond around animal diseases as well, right? Because that has massive implications when it comes to the food industry or the economy of multiple, and of course, the health of people, right, across the globe.
This is very interesting. And talking about that, another question that are related to that is not talking about Blue Dot, but I understood that you are also a person that is connected with this whole evolution that the world is having in terms of technology. And in your opinion, how do you think the world would be in the next 5 years? Just take a short horizon here. Considering all this tech evolution, what you know from Blue Dot, what you know from the scientific community that you are following, what are going to happen with health industry?
Okay,
Uh,
that's
and also health
yeah.
industry, and also if I understand it, you right, you are in the health industry in one way, and another way you are in the risk mitigation industry as well. Then, if you could comment this both industry would be very interesting because they have different challenges, and I think that you are in the between of these challenges. Yeah.
Of course, Alex, and that's again a great question. Whoever has asked it. So when it comes to technology, when it comes to okay, let's start with the health aspect first. So COVID-19 has definitely been an eye opener for governments, enterprise organizations, technology providers across the globe, right? Important thing to understand, and remember how I started my presentation, that COVID is not something new. There will be, in the next 5 years, I don't know, I hope there is no next epidemic or pandemic, but there will be infectious disease outbreaks, right? So that's how the healthcare industry will get affected. So more preparation is required, better equipment in terms of, or equipping themselves, the policy makers, the decision makers in enterprise organizations. They need to be equipped with the right technologies to ensure that the next big pandemic or public health emergency is controlled to the maximum extent possible, and its spread is mitigated to the maximum extent possible. And the same is applicable to the business continuity side of things as well, what you were saying, right? So now organizations need to start thinking more. So, and Alex, it's no new news that private sector organizations also have not been thinking about this. There are relevant departments in all major multinational companies who are talking about business continuity or supply chain management or demand supply planning, so on and so forth, right? But now is the time to ensure that the relevant departments and policymakers are equipped with the right technologies, because in a nutshell, although this seems sad and pessimistic, but there will be more outbreaks in future, right? Be it next 5 years or 10 years. Let's hope that we get more time to be prepared around it. But right now is the time to be prepared to the maximum extent possible.
No, no, I agree with you that we should first be alert and be prepared. And you, in both cases, you have the right technology already to start thinking on deep and how can I say more bold solutions for even if you don't have any other outbreaks, that would be a difficult odd. It would be difficult that it would be not what we have seen in the past, that outbreaks of new. Would be great if you are prepared for that, better prepared, I would say.
Absolutely.
I completely agree with you. Uh, Dev, we are getting to the end of our time here. Uh, there is any other issue that you would like to say, or a conclusion, a final conclusion, or your final words? It's the time, right time for doing that, and then we are going to. Unfortunately, it's a great talk, Dev. But I really appreciate your time, your way that you explain so complexity process that BlueDot is doing for uh, providing precise information for its customers in a so easy way to understand. And
Thank you.
please, it's your final words. Please
So
feel free to say what you want to say.
thanks, Alex. No, I'd just like to conclude. Remember the three questions that I had shown initially, and I would encourage all the listeners to my talk or to this entire conference to think about those three questions. What have we done differently in the past 10 years? What are the right type of technologies or options which are available right now to rapidly detect, assess, and respond? And third, if we are aware of those options, when is the time to act, right? So I'd just like to conclude from the bottom of my heart, because I work with these multiple organizations across the globe. And some of the things which, of course, I cannot share, I come across some kind of information where our platform is trying to help and collaborate with them. So with all due respect to every listener, I would like to say that the time to act is now, right? Use artificial intelligence-based technologies, be it any type of organization that you're involved with. Some examples I gave earlier. Now is the best time to start acting, to start thinking. Yes, coming out of COVID is important. At the same time, preventing the next epidemic or pandemic is equally important, so that what has happened over the past 2 years, it doesn't repeat itself, right? So that's how I would like to conclude my talk, Alex. Thank you.
Great, Dev. Thank you very much for your speech, for your conclusion as well. Yeah, and I do agree with you that the time for acting is right now, and because of that, it's so important that people understand deeper, understand better what this so important, so powerful technology uh, is capable to do. And I think that there is many opportunities to do so. We from A2AI, we would like to provide all the support on this journey for understanding better artificial intelligence. And then one way to do is to continue to watch our event. We finish our event tomorrow. Tomorrow we are going to have in the morning this speech with Samir Araújo from AWS for Amazon Web Services. He's going to say how to improve your business process with machine learning edge at Amazon SageMaker. It's a very interesting topic. Samir is one of our remarkable associates, and he's very also didactic to explain how to use technology. Very interesting. He's principal of AI machine learning solution architect, and he's now located in Holland, in Europe. It's very interesting at 8 a.m. tomorrow Brazilian time, Brazil time. Also, in the interview for tomorrow, in the midday or 1 p.m. Brazilian time, we're going to have the interview with Ricardo Santana. That is the leader of KPMG Lighthouse. He's going to have the speech, how to prosper in a world of AI, revealing the value of AI with 7 sectors 7 key sectors. He's going to show some case studies, very interesting, and explain a little bit of his experience of leading startups. Talking about startups, we have many opportunities for you to know some of our Brazilian startups from 3.5 to 4.5, from 1.5 p.m. from 2.5 p.m. Brazil time. We're going to have the opportunity to know 6 startups: Educa Cross, Sinqia, Neuromind, Greenbug, 7D Analytics, and this other one that I'm trying to remember. Oh my God, it is Greenbug. I think that I didn't. I know. I'm sorry. I know. And let me talk about Educa Cross. Educa Cross is going to, Reginaldo Gotardo is the CEO of Educa Cross. He's going to say how artificial intelligence can improve education. It's very interesting talk. Also, on the next, we are going to have the CEO of Neuromind, Patricia Tavares, how to reduce errors and frauds during the process of onboarding of customers and suppliers. Very interesting approach from Patricia Tavares. She's the CEO of Neuromind. Also, later on, we are going to have Guilherme Cabrera from Sinqia. He's the CEO of Sinqia, talking about computer vision and its multiple applications. Marcelo Vieira from Greenbug Predictions. He's also the CEO from Greenbug Predictions. Wildfire Predictions. This one is a good one. Wildfire Predictions. Also in the sequence, 7D Analytics. Ricardo Taborda, his managing partner, he's going to speak about helping companies and people to make better decisions. And finally, the CEO of AI Now, I think that's right. Democratize the use of AI to improve our efficiency. From Luis Cabanhas, this is going to be all tomorrow. Tomorrow we'll have a great day. I want to also to thank for our sponsors, H2O.ai, Suzano, Semantics for the great support for our event. And I hope to see you tomorrow again in this event. Great to see you all here, and thank you to keep watching us. We'll see you in the next time. Bye bye.